About Meralgia Paresthetica. Now what it is a condition that typically affects the hip. What it is we're compressing a nerve that tends to supply the top or the anterior aspect of the thigh. Patients may present with numbness and tingling, pins and needles, burning sensation, something like that along the top of their thighs. Now people that tend to might have this condition is someone that might wear like a duty belt or a tool belt or something along those lines that might be a little strapped on too tight. Now other forms of compression that may cause this problem would be obesity, pregnancy, or patients that may just be wearing clothes that might be a little too tight for them. So like previously mentioned, patients may present to the office with numbness and tingling, pins and needles, some kind of burning sensation on the top of their thigh. You know, they may even mention it kind of feels like it's itching. Now, walking tends to kind of make this a little worse because when the pelvis tends to get in that tilted position, it could stress that area that's compressing that nerve as well. So in the office, how we typically treat this is we really have to get into the area where the compression is and really stretch out the muscles, loosen up that tension so we're no longer having that compression sensation. On top of that, adjustments typically in the pelvis and in the hips, as well as maybe into the knee, something along those lines in the biomechanical chain that might help kind of facilitate better motion and movement in that area. So last but not least, what we might try to do is change up maybe posture throughout the day. Maybe we can move our tool belt around or our duty belt, maybe loosen up some of the tension in the belt as well as talking about how tight it is to the body, and that might help reduce some of that compression. As well as we'll give you some exercises and stretches to kind of stretch out that area, keep it loose. That way it doesn't tighten back up and again create that compression. So that's typically what we'll do in the office to kind of treat this type of condition. type of symptoms of this condition, we'd love to help. We'd love to get you in, get you checked out, because a lot of things can kind of create this problem or something similar. So we really have to rule in, rule out, what may be going on. So if you know someone that might be experiencing this, or you yourself is, please give the office a call at 513-463-3011, and we'd be happy